Good evening, everyone, and welcome to our Meet the Team workshop. Tonight, we're going to be talking about the most common questions we get during pregnancy and postpartum. We're going to hear from each of our doulas with some of the questions that they hear. And at the end, then we're going to do a breakout room where you get to chat with each of the doulas privately and talk a little more in detail. So please let us know if you will be staying by sending a message in the chat at the bottom. To start our evening tonight, we're going to hear from Laura Dos Santos.
Thanks, Amanda. So can I exercise during pregnancy? The short answer is yes. Exercise is safe and encouraged for healthy pregnant individuals. However, we always recommend discussing with your healthcare provider first to be sure there are no complications that would prevent you from exercising. Physical activity is great because it can help with your sleep, your mood, your energy level, reduce back pain, even ease constipation. And of course, it helps build your strength. The recommendation for physical activity is to aim for 150 minutes of moderate intensity physical activity every week using your large muscle groups. So for example, walking would be using your large muscle groups, whereas doing wrist strengthening exercises would be using smaller muscles. Moderate intensity means that you're moving enough to raise your heart rate and start sweating. You should still be able to talk normally through that, but it should be more challenging if you were to try and sing. If you weren't previously active, that's okay. You can start with mild activities like walking for 10 minutes at a time and gradually increase that, but always listen to your body. Continue the activities that your body is used to doing. Choose ones that are low risk for falls and have low contact with others. So I'm going to go out on a limb here and say you might need to stop the contact football. Some really great activities that you can do are walking, stationary cycling, swimming, and just ensure that you are fueling up adequately and drinking lots of water so that you're staying hydrated and avoiding getting overheated. So in summary, yes, it is encouraged to exercise during pregnancy, but there are a few factors to consider to ensure it is being done safely. And now I'll pass it on to Christy.
Hello. So one of these things that is sort of perhaps not exactly this question was a common question, but sort of a common concern. Like, what if I can't take the pain? I'm not sure if what the pain is going to feel like in labor. I'm talking about, of course, hopefully not from postpartum or anything else like that. So labor pains are highly subjective. How you handle it, and how you handle pain in general may not necessarily apply to how you handle labor pains because it's an entirely different beast. It's a lot more similar to, say, having a really intense workout, as opposed to like breaking a limb, that kind of pain. So we're talking about muscle pain and intensity of muscle contraction is what you feel in labor. I would say pretty much everybody can take it. The sticking point that I often see is when we have a first-time labor, for instance, the person has been having contractions for quite a long time, which is totally common in first labors. And they just start to get tired because maybe the contractions have kept them up overnight and they haven't been able to sleep, and your ability to cope with the sensations of labor starts to diminish the longer you go. So it's not necessarily that the pain is so intense that you can't handle it. It's just that you start to get tired. So you can plan for this kind of thing by perhaps preparing ahead with a birth or postpartum or birth or doula or childbirth educator by taking some classes to learn how to cope. But if you're with me, you'll probably hear me repeat one of the adages that I picked up when I was working in Mexico, in that birth is 80% mental and 20% physical. So the preparation that you're going to do to be able to handle the sensations of labor is going to be a lot of mental prep. Whatever helps you to stay calm or stay focused or connect with your breathing, connect with your body, the sensations in your body. So free tip, all of the things that can help you do those things like meditation or yoga, or even just mindfully walking through the forest, something like that. Those things are actually going to help you to cope with the sensations of labor a lot better than just say getting tools like the exercise ball or a comb. Those things can be quite useful, but those are the things that are a lot more subjective, one person to the next, as opposed to the mental preparation. So those are my free tips on handling labor sensations. Passing it over to Amanda Kennedy. Take it away, Amanda.
I'm back. I'm Amanda. I'm a birth and postpartum doula with Helping Hands. One of the questions I hear a lot, and one that we talk about in our prenatal classes on infant care, is how often should I give my baby a bath? Or do I need to bathe my baby? Or how do I bathe my baby? Lots of questions around it. Even, can you help me bathe my baby? Absolutely, we can. It's one of the really joyful parts of supporting a new family is helping with those first baths and helping walk through them and helping with videos and pictures and laughing through the process when things kind of go a little sideways sometimes when babies like to do fun things while they're in the bath. But in terms of how often, when the baby still has their umbilical stump, you only need to be doing a sponge bath, and you probably will only need to do one. It's recommended that you wait 3 to 5 days after birth before doing that first bath if possible. And then the umbilical stump will probably fall off between 7 and 14 days, so you're probably only going to do 1 or 2 sponge baths. After that, Health Canada recommends 2 to 3 times per week bathing your baby. But, if they don't love it, babies don't get that dirty, and you're cleaning the dirtiest part of them every single day, multiple times a day. And so oftentimes it can be challenging to find a window of time to bathe them. So if it's happening once in a week, that's totally fine. You can do lots of spot wiping, cleaning under their neck, in kind of those fun little spots where they collect. Inside the palms of their hands or in elbow creases under the neck is one of the favorite spots to get a little funky. And then if they really love it, you can do it more frequently, just being mindful of what we're using for products on their skin and protecting them. That is how often you should give a baby a bath. And I will pass it on to Esther.
Hello, my name is Esther. I'm a birth and postpartum doula with Helping Hands. And one of the biggest questions I get asked is, how do I know when my baby is tired? And such a valid question because you got this new creature in your life and you got to learn how to read their cues and understand when they need to sleep. So the first thing that we'll look at is the sleep cues that the baby is showing you. So these physical and behavioral signs that can help you decipher the baby's needs and that they're ready for sleep. So for example, I'm tired can look like flush brows. So right in between their eyebrows can be a little bit red, or a glossy stare. So they'll just like be looking at nothing. They'll be spacing out. I'm ready for a nap. So when the baby feels like they're ready for a nap, that can look like they're getting a little bit fussy, some big yawns. I find when they're like a month or 2 in, maybe they start rubbing their eyes a little bit. And I'm overtired can look like frantic crying, like a rigid body, like they tense their muscles and they kind of like try to push away from you. The second thing that we can look at is the cues for sleep that you are showing the baby. So you can actually create cues for your baby. This involves showing a predictable environment, environmental signs such as dimming lights, dressing the baby in a swaddle, putting on a sound machine. So just creating that predictable routine for them. And that can help with letting them know what the sleep cues are over a long period of time. And it can help them form a nap time and will build up the baby's understanding of what is about to happen next and thus prepare them for sleep. For a newborn, the wake window generally on average is 45 to 60 minutes. And if we preemptively offer baby a nap after their wake window is finished, it'll help us avoid the super fussy, overtired stage. Even when we see that they're a little bit energetic, we may have missed a small cue that we didn't notice, and I would still offer the nap just so that they can get that rest in, because babies need lots of sleep. This can help make sleep times easier and lead to a more restful sleep in the evening. And as you grow alongside your baby, you'll learn more about the nonverbal cues that they are showing. And I'll pass it on to, I don't know who's next. Heidi?
I'm so sorry. Now I'm unmuted. My name's Heidi. I'm a birth and postpartum doula. And my question, or the question that I hear a lot from new moms, is how do I know my baby has had enough to eat? And this is a really important question. When parents are feeding their babies with a bottle, whether it's formula or express breast milk, you have a gauge. You have a quantity that is going into baby. So that's really reassuring for parents. But parents or moms who are breastfeeding exclusively, unfortunately, our breasts don't have gauges. And this is a real design issue. And it causes a lot of anxiety for new moms. So there are a couple different ways that we can approach this question. The first one is to really think about input, to know how you're getting milk into your baby. So number one is the best thing that you can do is you and your baby develop a good latch when you're breastfeeding. So that a good latch means a lot of breast tissue in the baby's mouth, not just a nipple, but rather lots of that breast area, because the milk ducts are in the area around the nipple. So latch is super important. The second thing is learning the difference between a suck and a swallow. And there are wonderful videos online where you can just sort of Google suck and swallow videos for infants, and they will show you what an infant looks like when it's just sucking and when it's slowing down and swallowing milk. And so that you as a new mom are able to look down and see that your baby is swallowing is super important to know that they're getting something. Number three, we recommend when you're breastfeeding, especially in your early breastfeeding journey, that you're switching sides frequently. So the recommendation is often that you will spend 3 to 5 minutes on one side, switch the baby to the other side. Often you'll see the baby will slow down in the amount that it's swallowing. And the reason for this is the switching is that we were taking advantage of a natural process called a milk ejection reflex, or letdown. And that is a way that baby gets kind of a gush of milk when it first starts breastfeeding on one side. And then while it's doing that, the other side starts filling up again. So that's why we encourage frequent switching as well to start filling babies' tummies. The fourth way to see if your baby has had enough to eat is what I like to call the contentment test. Some people call it the turkey test or the milk coma test. But really, what you do after you feel your baby's had enough, you lay them down flat somewhere without you touching them, without a blanket, and just look at them. Are they relaxed and happy and sleepy, or just content? Or are they starting to roll their head around, wiggle, fuss, open their mouth, turning side to side, looking for more milk? So that gives you a clue. Maybe that baby needs another top up or a dessert. And the last way, most important way to see if your baby has had enough to eat is output. So if you're getting lots of pee and poo diapers, you can feel really content that your baby's got milk going through them. So good luck, and we'll look forward to talking to you later. I'll pass it on to Shondell.
Hi, my name is Chandel, and I'm a postpartum doula with Helping Hands. A question that I often get is it okay to give my baby formula? And a lot of new moms are concerned about that because sometimes their milk hasn't coming fully as yet, and they think that their baby is not having enough milk, and they want to try the formula, but they're not sure. I usually reassure them that it's okay as long as it's ready to go formula. And if they're not sure, they could always consult their doctors. I also give them a really nice example where they seem to love it. I always say, what happens to the newborn babies that are in the hospital that you can't touch them or you can't like be around them? What if you have to leave them in the hospital? They still get formula and they're okay. Nothing happens to them. But I also let them know that it's up to them. Like it's their decision to if you want to give your baby formula or if you don't. I always say if your milk hasn't come in as yet, sure, formula is okay. Um, Now I'm going to pass it on to Mandy.
Hi, I'm Mandy. I'm a postpartum doula at Helping Hands. And the question I want to talk about is how can I avoid nipple confusion? So what is nipple confusion? It's when the baby has difficulties to switch between the breast and the bottle. And the question is only for those parents who decide to breast or chest feed. So when you search for this question on Google, you will find a recommendation to wait at least 4 weeks before you offer a pacifier or a bottle. If I would read it, it would raise more questions such as how can I feed my baby if they need to gain weight, or how can others support me with feeding the baby if I can't be there 100%, or how can I soothe my baby, for example, during a car ride or when I can't breastfeed. And so before I answer my questions, I want to explain you with a worst case scenario how nipple confusion can occur. Imagine you are in the hospital after giving birth and someone explains you how the breast or chest feeding works, but you are so exhausted that you can't really take it in. So then you come home and you have no idea what to do. And your baby is crying and feeding is not working, so you quickly reach for the bottle and the baby is quickly very content and gets full. So what is the baby thinking now? Yes, that's it. That's exactly what I want. I don't want to work for my milk. I just want to have the milk flowing into my mouth. And then for the next feeding, you try to breastfeed again, and the baby refuses to breastfeed. Why? Because the baby realizes that at the breast they have to work for the milk. So how can I avoid the nipple confusion? And to avoid it, in the first place, I would say establish good breastfeeding. And I would recommend to inform yourself about breastfeeding before you give birth. And for example, there are many resources, and Heidi mentioned some, and also at our last Meet the Experts, some doulas presented great breastfeeding resources to learn from. And also very important is to get help from the beginning to make sure everything goes well with the breastfeeding. There are many lactation consultants or also doulas know how to breastfeed. And if the foundation is stable, you can build on it very well. So if you decide that your baby, to give your baby the bottle with formula or pumped milk, or maybe it's even necessary to give your baby extra milk, and then it's very important to have the right bottle with the right nipple and where the milk flows slowly from. And when you bottle feed, it's important that you bottle feed in a way that it's resembling the breastfeeding, and we call it a slow-paced bottle feeding. And if you decide to offer your newborn a pacifier, it's just as with the bottles, it's important to choose the right shape and size of the nipple. And additionally, I want to mention, if you want to use a pacifier, especially for newborns, the pacifier should not be offered for constant sucking. Usually a newborn cries because they are hungry or if their diaper is full. So these cues should not be suppressed by a pacifier. And of course, a pacifier can be a good tool to soothe the baby until, for example, the bottle with milk is ready. So remember, before you offer the pacifier, first check the diaper and offer food. And I think I'm the last one, and I pass it on to Amanda.
Thank you, Mandy, and thank you, everyone. Those are great tips and definitely questions I think we've all heard and really well thought out and evidence-based answered. So thank you for that. Next, we're going to go into our breakout rooms. So you're going to get a chance to chat with the team members on the call this evening. The doulas will move from room to room, so you get to just sit tight in your room and wait for them to come. We'll give a 1-minute warning before we're going to start switching people around. It may take a few seconds to get everyone switched out, so no worries about that. And please put your camera on so we can get to see you. We don't care if you're in your PJs. We want you relaxed and having a great time. So sit tight and we will start the breakout rooms.